Let us let close packed position of a joint. So what is close packed position of a joint? This is the position in which the concave and convex surfaces of the bones taking part in a joint are fully congruent and are in contact with each other over a maximum area. So, close packed position of a joint is one in which the opposing surfaces, one concave and the other convex of the bones that are taking part in the formation of a joint are fully congruent and are in contact with each other over a maximum area. So you can look at this picture which explains how much area of the bones are in contact with each other. This is a locked position. So there will be maximum contact area, maximum stability, plus the ligaments and capsule are under maximum tension in close packed position. And the joint is firm and rigid. There is very minimum or no mobility in the joint, as the joint space is less. In close packed position, joint dislocations are rare. In contrast to the close packed position, we can see the loose packed position. Now let us see what is loose packed position. So what is loose packed position of the joint? Look at this picture. And this position is also known as resting position. The articular surfaces, if you compare with the close packed position, they are in minimal congruence. Only a smaller area of the bones are in contact with each other. This is called minimal congruence. The supporting structures and ligaments, that is the capsular ligaments and other ligaments, they are more lax in loose packed position. Joint mobilization techniques are performed in this position, that is loose packed position. Is also known as resting position. Articular surfaces are in minimal congruence. Supporting structures are more lax. Joint mobilization techniques can be performed in this position. See this one. You can observe what is the close packed position of the knee joint, and this is the loose packed position of the knee joint, where there is some flexion of the joint can be observed. So now answer to the MCQ. The close packed position of all the following joints are in extension except A. Knee, B. Shoulder, C. Wrist, D. Elbow. So the answer is shoulder joint. The explanation for this is in other joints, the close packed position is in extension, excepting the shoulder. In shoulder, close packed position is abduction and lateral rotation. Similarly, in the hip, extension, abduction and medial rotation position is the close packed position. So now you have understood what is close packed position and what is loose packed position and their clinical importance. Picture shows the close packed position of shoulder joint. So the close packed position of shoulder joint is abduction and lateral rotation. Abduction and lateral rotation. About the hip joint. The close packed position of hip joint is extension, abduction and internal rotation. That is the close packed position of the hip joint is extension, abduction and internal rotation. So these two will give you the idea of what is close packed position of hip joint and the shoulder joint. The other joints were in close packed position in extension as was mentioned in the multiple choice question. Hope you have understood the concept of close packed position and loose packed position of a joint.